in a normal doctor-patient relationship, there's the fiduciary obligations that go along, ethical obligations that are part of that. And they are simply that the doctor have you as the patient's interests held highest. You expect that my advice and my actions in treating you are in your best interest. In all relationships involving controlled substances, that's not true. And I don't think that's made clear to people in doctor-patient relationships or the public in general. I think it's very important to understand that those expectations, those normal expectations of a normal doctor-patient relationship in which your interests are held highest, the doctor is doing everything he can to help you in your individual situation, do not apply. Quite bluntly, the doctor's first obligation under regulations and laws that currently hold sway, his first obligation is to make sure that you are not exhibiting red flag behaviors, or more formally, aberrant drug related behaviors. These, unfortunately, apply to every pain patient I can conceive of in the course of a normal treatment. I'll tell you exactly what I mean. First of all, what are aberrant drug related behaviors? If you go to a doctor and say, "Doctor, I've tried MS-Contin and morphine and they don't work for me. The only thing that works for me is oxycodone or Dilaudid," that's a black mark on your record. Asking for drugs by name or requesting one drug over another is a sign of drug-seeking behavior. If you run out of meds early, black mark. If you go to an emergency room and ask for pain medications and don't report that to the clinic within a certain number of hours, black mark. Why I say that, and it goes on and on, I think that maybe gives you the idea. If you're late for appointments, if you miss appointments, if you don't follow the pain contracts, which very often have clauses, literally, that say I understand that the doctor will cut me off all opioid medications if I don't follow recommendations that are given to me. The reason this eventually applies to all pain patients may not be obvious. If you come to me in chronic pain, which means you've had pretty constant pain for weeks and weeks or months, you are sleep deprived, you have been immobile and inactive, your body has been going under tremendous stress hormone response, you're in bad shape. Now, I start to do an opioid titration to effect. You start to get better. You've been immobilized for months. Finally, you can pick up your kid. You can go do the laundry. You can do a shopping once a week. You can start to help out around the house. Pain patients are people who have been frustrated in their lives. And when you relieve their pain, they want to do things. They want to have a life. What happens? They move around more. They pick up the kid. They take out the garbage. And that's all good and to be expected. But that activity may, and usually does, increase pain levels. So they go back to the doctor and they say, "Doc, I was doing great, but I need more." Black mark, drug-seeking behavior. And then they get angry about it. Having had a taste of freedom, a little bit of their lives back, things maybe they thought they'd never be able to do again, and now it's fading away, and they're not getting the dose increase. In fact, all of a sudden everybody's looking at them like they're a drug addict instead of a patient. Don't get angry, because if you do, it's another drug-seeking behavior. It's a rigged game.